Wait a second, wait a second, wait a second. You mean when I change jobs that my old department is going to reach out to me for help? Hey guys, ECRG here. Today we're talking about, can you still help your old department when you transition to a new job? Now, obviously, this is only for people that transfer internally within a company. You probably wouldn't be doing pretty much any help if you transition to a new company at a different role, doing any help with your old company. Pretty much that's just going to be a hard deadline. When you leave the company for good. And it somewhat should be like that when you transition from one role to a different department, to another role in a different department at your current employer. Now, I know a lot of what happens in the job place, specifically in clinical research, is you get a job and then you want to transition to another department, but because you're still in the company, you're easy to reach out to for people that need to ask you questions or need your help with something. And I'm talking about this specifically because this recently happened to me. And I wanted to talk to you guys a little bit about how I handled the situation and some things I think I did well in that situation, that maybe you guys can apply to your own situations as we begin leveling up in our careers. So one of the things I thought about was, when the person reached out to me, was the guidelines for my situation. So my new line manager told me that I am not to help out the old people. I gave them a date. I worked really hard to make sure that the transition to the new person was as smooth as possible and that they had all of the materials they needed in order to do the job successfully. So she said, make sure that once that date is reached, you do not help them out too much. She said, I was saying I might need to help them out, 30 minutes here or something like that. But she said, limit it to 10 minutes. And she was very serious. She said, if it becomes a problem, she's going to address it herself. So I noticed with her tone in that situation that she was serious. Do not help out with anything that's going to take up a lot of your time. And I thought her reasons were extremely valid. She said, this is your time to learn about the new role. You need to be focused on that, really double down on that. And you need to block out the old noise, and they need to understand that. She said, at the end of the day, you're just cheating yourself because this is your time to solely dedicate to this time. And I had about 4 to 6 weeks in the training program to really learn about the role and really delve deep into how to do the role well. So when she put it like that, it really clicked in me that, hey, I need to do my best to not, you don't want to be rude about it, but I don't want to say to not help these people, but that's basically what it is. I mean, because these were my former coworkers, so you definitely don't want to be rude to them or anything like that. And you're obviously going to have some nice feelings having dealt with them in the past and worked with them in the past. These are your former colleagues. But when she put it in that way that, this is my time and I'm really only hurting myself by taking time out of my time to, focus on these past tasks. And that really resonated. So if any of you guys are going through a transition period like that, where you have training 4 to 6 weeks of a program or something like that, just remember that that's your time to learn the job to the best of your ability. You're not going to get that time back. So really do your best to make sure that you get as much out of that time as possible and really limit the past things that people are trying to, get you to do. And, the task that was reached out to me was, there was a meeting that the other person that I transitioned on to the study, this is a project coordinator like person that was supposed to be doing the meeting minutes, and they were not in the office. They had PTO scheduled for that whole week. And so the project manager reached out to me, who was also my former project manager, reached out to me asking if I could take the minutes. And so as soon as she asked me that, the first thing that popped in my head was, hell no, I hate taking minutes. But then I thought, okay, I quickly thought after that, well, okay, minutes, the meeting's an hour long, so that's going to take me an hour to do that. That's already past the 10-minute to 20-minute threshold that my line manager gave me. I can't do this. So I thought about that. And then I also thought about, well, minutes, it takes an hour to write the minutes. Then I've got to go through, comb through them, clean them up, send them out to the team. And then I have to have that hanging over my head. So it's a whole like 4 or 5 day process to do a set of meeting minutes. And I was like, oh, heck no, I can't have that over my head. I'm in a training program. I'm not doing that for you. So I told my project manager no. My former project manager no. And that was really important to do because, like he said, that's my time. And I really need to focus on that. So unfortunately, it worked to my benefit that, one, I hate doing meeting minutes. If you should know by some of the videos you've seen on this channel that meeting minutes are the worst. If you haven't seen the video where I talk about the worst task in clinical research, I'll just give you a hint at what that is. But that's what really matters, is focusing that time where you're transitioning is your time, and that is not to be interrupted by anything else. So keep that in mind. And if you don't know what your situation is, how much time you should be spending to help the former department, or some places may not have a formal transition period like you do at other companies, but you should talk to your line manager about that. What is typical for if the old department reaches out to you for help? How much help can I give them versus how much help can I not give them? So I could tell by the tone in my line manager's voice not to help these people out by too much, because this is my time. And this is the only time, and to really cherish that time. So I didn't. And, the old department didn't really seem too mad about that, but, it is what it is. And it felt good to be able to say no and really put myself first in that situation. So obviously everything's going to be a little bit different depending on which department you're transitioning in and out of, but I would keep those two things clear, like when the actual transition date is, so at what point you can really, not be held accountable for those roles, and then know what your current line manager thinks about you helping out the old department and what the protocol is around that, especially if she's going to be able to help in and kind of shield you from the old people, and you can just put the blame on her saying, hey, my line manager won't let me do it, whatever. So that's that. Can you still help your old department? And, that's the end of this video, guys. So share this, like this video, share with all your friends, email us at eliteclinicalgroup@gmail.com as always, guys. And comment down below what some of your horror stories are with working, with transitioning to a new job, and what old departments have asked you to do. So comment those down below, guys. All right, take care.